up to the vaping ordinance?
Yeah, so over the summer I had a conversation with Dave, Lydia, and Dr. Stein. We had made some changes to our county parks ordinance, and I noticed one of the areas that we do prohibit tobacco use, but it wasn't clear in our code to explicitly call out vaping as well, which I think would go along with the intent of those restrictions. And so through conversation with staff, I thought it'd be appropriate to start a conversation here at the Board of Health and hopefully get a recommendation from the Board of Health to ask the County Commission to make this change to county code. And so I wanted to put that out there, and I think Dr. Stein had mentioned a couple of other items that are vaping related, and so I would certainly be open to having that conversation as well, but I thought a good place to start would be making those clarifying changes to our county code so that it was clear that that went along with a tobacco prohibition. In particular, as we see in the news now, the issues that are arising from vaping, and so being aware of that, and then trying to use that as an opportunity to have our public health folks do more outreach and have a sort of concerted and focused effort on it as the issue continues to become more and more, center for us. So I wanted to put that out there. I'd be interested in hearing thoughts on that, but certainly would be also looking for a recommendation from this group to make that code change.
So to clarify, our code around tobacco is not as clear as it needs to be by itself. So that has to be adjusted as well. So we'll just roll this into that corrective process to make sure it more closely resembles what's in RCW.
I don't know, Dr. Stein, if you want to maybe jump in and add a little bit more to that, and just to, I hate to say flavor the conversation because that seems kind of yes.
Right, absolutely. So vaping is a huge topic right now. I think that I saw some data that showed that in the past year, the use has increased by about 87%, which is huge. And I think that's, and this is just conjecture completely, but I think that's probably what's contributing to this current outbreak of this vaping-related lung injury. I'm guessing it was around before, but we're just finally now, because of the increase in use, starting to see these cases that are coming out. So this is absolutely a big topic, and it's very much in the news. It's very much on the forethought of a lot of people, especially when it comes to teenagers using these products. And I think what Commissioner Schutte is mentioning is that we want to kind of come out as I would support coming out as a community in order to reduce the visualization and reduce the notion that this is an acceptable thing to do on our public lands. I think the more people who are using in public areas, it basically conveys a message that this is good and acceptable. There are some uses for vaping, and we can get into that later. But in general, especially as these kids are using it more often, we had kind of in the history we had a lot of success with reducing tobacco products for many years now because of reducing childhood tobacco use. And we know that people who don't start smoking by the age of 21 tend not to smoke at all, or start smoking later on in life. And so this current trend is really creating a new population of people who are addicted to nicotine products and will sometimes ultimately start smoking again. So initiatives like this I would strongly support. Other things that I mentioned when I was speaking earlier is trying to reduce the marketing to younger individuals. Another very successful initiative that the country utilized previously was prohibiting flavored tobacco products, and because they do strongly promote younger individuals using. And so if I would, the federal government is currently evaluating the potentially prohibiting these products on the national level. But given our current case and given that we want to come out in strong support for public health, I think this would be a really strong move to prohibit flavored products within our county lines. So that those are, I know that would probably come along with some hesitation because the flavored products piece could impact businesses in our area. But in my role as a health officer, I think that would be a strong statement to make.
I believe education has to go along with that. I see on television some of the advertisements, promoting it,
Mm-hmm.
because you can then not be smoking tobacco, but you can be vaping these.
Mm-hmm.
So I think the education, I think that our kids aren't thinking that this is just as bad or worse than the tobacco itself.
I think that one of the big issues is that we don't have long-term data for these
Mhm.
products. And my other position, I'm a clinician, so I'm a family doc, and I speak to tobacco use frequently with my patients. And probably, I tell my patients, probably it's better than smoking, but we just don't have any data.
Right.
And we also don't have regulation. And so there's not really a strong sense of what is put into these products. There's not really a lot of them are made in these little mom and pop places that there's not a specific level of nicotine that they're using or other additives. And so, down the line, we're starting to learn maybe that's not the case. It's hard to say right now because it's such a new phenomenon, and we just don't have any safety data yet for long-term use.
So I personally think that we could maybe pass something here to move on to the commissioners anyway. Would anybody have a?
As far as the flavored products go, I know there's a number of bills being considered for this next legislative session,
In
and
the
all of them
state.
include preemption.
Mm-hmm.
So I'm not sure what we can do as far as a local ordinance on flavored products when the state has preemption.
But we could at least pass that we.
We can pass a support.
Yeah.
Well, if I recall, the ordinance that governs what you can do in county parks
we could
prohibits
definitely-
smoking and drinking. Isn't that right?
Right, and we can prohibit that in county parks.
Yes.
County parks, county property.
Yeah, I think
County
that part
office.
is very clear. We've had,
Mhm.
Yeah,
We
so
can
couldn't we
regulate
just do that?
Mhm.
At least for now.
Yeah.
and I think it would be helpful if we came back in November with a
Mhm.
little bit more information on what a flavor ban would
And,
look
Would
like.
do
and
and
I'll
how
also
to-
know by November, we'll have had legislative steering committees for both Wasafo and Wasac by then, so I'll know more by then.
Yeah, so I mean, personally, I would be supportive of evaluating the flavored vaping and products like that. I think, that it wasn't too long ago, probably in some of your lifetimes when we had doctors endorsing, like the doctor's choice, Lucky Strike or whatever, and
Ronald Reagan even.
right, yeah, the Gipper. So I mean, we have we've come a long way on tobacco, to the point where their advertising is severely limited. It's still kind of the Wild West on vaping and vape products, and I think there's a lot of work that ought to be done and will be done at the state and federal level on that. But I think we have an obligation and an opportunity to get out in front of some of these things, in particular since we're now home to one of the few cases in the state here in Mason County.
Mhm.
I was hoping this would be a healthy alternative. I mean, that's what we heard at the legislature,
Yeah.
that the vaping was going to be the healthy alternative to cigarette smoking.
I think one of the things we're going to see though is in individuals with other comorbidities, it becomes a confounding factor that makes, you don't know which way it's going to go then.
Right.
And I think the way to address that is that kind of piggybacking on what I was saying earlier is it's probably better than cigarettes, but at the same time, we're also promoting this in people who don't smoke. And so this is a way that teenagers who haven't been exposed to cigarette use are now using these products a lot more readily and are getting the nicotine addictions.
Well, it tastes good and it smells good, so.
Exactly. If it doesn't taste good, a lot of them probably wouldn't use it.
Make them
Okay.
garlic flavored or something.
Yeah. I mean, garlic sounds wonderful.
Yeah, right.
So do we need a motion to?
Yeah, I would, if there's somebody willing to make a motion on that, I would think that'd be helpful.
I move that we support the prohibition of vaping in county parks, or county property.
Right, I'll second.
Okay, all those in favor?
Aye.
Aye.
Okay.
Very good, thank you, appreciate that.
I know I should know this, but do you have any clue if we have the cigarette prohibited in city parks?
I would imagine, I think that was a
I haven't
big
heard.
push
Yes, it is.
several years
I
ago.
was gonna
So
say, I
City
think it
County
is.
is-
Mhm.
So I wonder if we need to go back and do the same
You may.
for the city park.
It wouldn't be a bad idea.
Okay.
I think we should also look at our county policy for our employees to make sure that that's covered in there too.
I will check with Dave or Jeff on this.
Interestingly, last summer I went through Forest Festival, and then the year before I went to Oyster Fest. Of course, when it's pouring, it's tough to smoke. But and did actual counts, and at Forest Festival, I think I only saw 5 or 6 people smoking as I, in my walk through back and forth. So the number of people smoking in public has dropped, a great deal.
Right,
So
there's quite a few vaping.
But vaping is,
Yeah.
is
Yeah.
another
Yeah.
story.
Okay.
And I think the reality is, whatever action we take on this, probably get some heat for it,
Mhm.
because I think there are a lot of people who do use vape products. Some even use it as a, smoking cessation tool.
Right.
But I think there's this element of it that's been promoted as a safe alternative, and I just don't think that's there yet. I don't know that we have, we're
Right.
seeing the issues that we are.
And
so.
with what's on the news, they shouldn't think it's a safe alternative.
Right.
Okay.